Alrighty. Well, I'm Dr. Corey Howard, a medical doctor, board certified in internal medicine, gastroenterology, anti-aging, functional regenerative medicine in actual private practice, seeing patients on a daily basis. And I'm really here to improve health. That's my main goal. I'm doing that as a service to everybody so that we can really understand what health is about. And so in our previous episodes, we've talked about some aspects of health. And I'm going to show you those in a second. But today I'm going to dive into something as a part of this, which is what is going on in the environment. In fact, what is lurking in your world right now? And then the question becomes, what can you do about it? Can you avoid it? Can you not avoid it? These are questions that we need to answer. But at the end of the day, what we need to do is take a look again at how we are going to define health. So health starts with looking at your nutrition. And remember, there are hundreds of billions of chemical reactions occurring in the body per second. And you really can't control them, but you can control what you put into your body. Physical activity, but I like to broaden that topic to fitness, which includes brain fitness and heart fitness and bone fitness and muscular fitness and body fat distribution and metabolism. Next is stress, or how your body perceives stress, your stress. Sometimes people think that they are not stressed, but for some reason the body is perceiving that because it really doesn't know that your arm hasn't bitten off by a lion when you're at work. You may be stressed and meeting deadlines or things like that, and all of a sudden, your body has a response, and it's not your fault, but it's just part of what happens evolutionarily. Your body doesn't know the difference. Sleep is a very important topic, and we haven't really dived into it quite yet, but I'm going to give you some clues about that in later podcasts. We also have relationships. Relationships are not just with your significant other or spouse, but it's also with your friends, and who are the other people that you're interacting with, and how are these interactions? Because one thing that we have learned over time is that loneliness is a killer. So you can actually be in a relationship and still be lonely, but what happens is that you really have some problems. But we're not going to talk about those today. We are going to talk about the environment. And so environmental factors turn out to be exceptionally important. So first of all, here's a list. And I decided that in these kinds of podcasts, I kind of like the multimedia approach. I like the approach where, I'm not just talking or interviewing somebody and then giving you information, which is great because if you're at the gym and you're listening, or you're listening in your car, fantastic. But I'm going to ask that if you have the time, go ahead and take a look at the podcast, not just on the other platforms, say Spotify or on Apple, but actually go back onto YouTube, take a look, because this information will be there for you, and these slides will be available. There's nothing proprietary to me about them. They're just information that you can actually use. So environmental toxins. If you take a look here, the list is pretty long. From pesticides, to heavy metals, phthalates, BPA, plastics, organic compounds, some different types of perfluorinated chemicals, dioxins, PCBs, asbestos, radon, formaldehyde, which hopefully you're not getting exposed to too much formaldehyde. Of course, if you're a physician in medical school or somebody going through training right now, then you're exposed to some cadavers and you've got some formaldehyde exposure there. Flame retardants, which are pretty popular in carpeting and your couches and things like that. Tons of air pollutants, and certainly depends on where you live in the United States or around the world. Again, some different kinds of plasticizers, not just plastics, but the things that turn, plastics into plastics, and then, chlorine and chloramines and things like that. So these are a big topic, and I'm going to hit on a lot of them that I think are really, pretty common, and things that you might be able to do about it. So let's dive into that. So volatile organic compounds, what are those? Those are things that you have in your house. Talking about paints, talking about varnishes, cleaning supplies, things like that. But believe it or not, even your air freshener could potentially have these compounds in them. So you've got to be careful which ones you actually use. Pesticides. Now, there's a big push to take a look at organic. I'm going to show you some information on what's organic and what's not. But basically, in a nutshell, organic, the classic definition of organic is carbon-based. So, that's kind of basic. But organic in this particular instance is that things are grown without pesticides or other topical products that can affect the growth of a plant. Mold and fungus, this is something, so we live in Florida, and Florida happens to be the land of a lot of moisture. So there are lots of places in the country and around the world like that. And there are a ton of molds, and some of them are just flat out nasty. They are nasty in terms of, black mold. In fact, one time we in our own house, our daughter was having some trouble concentrating at school when she was like in fourth grade or something. And we're like, what is going on? We were just trying to figure this out. Do we need to take her to a doctor other than us taking care of her? And lo and behold, took a look at the base of the wall, and it was soft. And so I was like, all right, get out. Cut the wall, big bunch of black mold, got rid of it, remedied the problem, and lo and behold, boom, there you go. And she's done great ever since. Polyvinyl chlorides, which are plastics and plastic products. And one of the problems with this is in your own favorite tool in the kitchen, besides now the air fryer, which is really everybody's one of the favorite things now, is the microwave. And microwaves pull these out, and they could potentially be toxic. So if you're going to microwave stuff, just FYI, use glass. Try not to use plastic. Heavy metals, these accumulate in things like aluminum, all right? So aluminum, lead, cadmium, mercury, arsenic. Cadmium, of course, is like if you're around a nuclear power plant. And it turns out that stuff is real. I actually had a patient. She had high cadmium one time. And I was just like, do you happen to live near a nuclear power plant? And the answer was yes. She lived near 3 Mile Island, which was where there was a nuclear accident. And turned out that wasn't a problem for her, but just something I noticed. But aluminum is very interesting because it has been linked to certain dementia problems, including Alzheimer's disease. And it is in your deodorant, which is mostly the antiperspirant part. So if you're using a deodorant antiperspirant, you better take a look and see if it's aluminum. So I'm not saying don't use those because, you might wind up being a little smelly, but that's your personal choice. All right, bisphenol A's, BPA, and benzenes and things like that. So let's take another look at the neurotoxins. These are the neurotoxins. And this is a great picture because I love this picture. This picture is one thing that if you're going to look at anything on this entire podcast, look at this picture. Because you got manganese and fluoride, which is in your toothbrush, and that's going to be a problem, even though that the American Dental Association says that it will reduce the risk of cavities, but it can also cause other problems. You've got problems with your pesticides and DDT, DDE, tetrachloroethylene products, these polybrominated ethers, which are in your furniture. So be careful where you get your furniture from. Arsenic. You're like, arsenic? What? Yeah, well, guess what? Guess where you get some of that from? Apple seeds. Don't eat the apple seeds, okay? Or at least don't chew them. If you just happen to eat them, you'll poop them out, so don't worry about it. All right, lead, same thing like watermelon seeds. You won't grow a watermelon inside your body. All right, so lead, mercury, and I have a little sushi there because mercury is found in fish. I'm going to show you a little bit more on that. Toluene, which is in gasoline, of course. Ethanol, which some people love, some people don't. But the data is coming out that no amount of alcohol is actually safe. And even though there's some information from the Mediterranean diet, specifically about resveratrol, which, by the way, is highest in Pinot Noir, the reality is that no amount of alcohol is really safe. I'm not saying not to do it, and I'm not saying that I wouldn't do it, but it just happens that there's more and more data that shows that ethanol is pretty bad. And just so kind of reminder, just in case you didn't know this, ethanol is a sugar. And so glucose, your good old table sugar, is actually 6 carbons. And ethanol is a 2-carbon sugar. It's like jet fuel to the body in terms of its toxicity. And then a lot of other products that you might find in things like cars. So let's take a look at BPA, which is very, very common right now. Plastics. We've had a big issue right now with microplastics. Microplastics getting into surgical fields where people are going in and scooping out plaque in the arteries, and they're finding that there might be some microplastics there. This is, of course, from dumping into our environment and then them breaking down. And then once they break down, they are actually small enough to get into fish, and then you eat the fish and things like that. So these are in bottles and certain types of food containers. And really what it does is it messes up with your endocrine system. It actually causes some irregular signaling of your estrogens. So these can be considered in the category of xenoestrogens. They're not estrogens, but they're estrogen-like, and they can actually cause quite a few problems and actually might even promote obesity, although the mechanism is questionable. Phthalates, again, these are plastics, but also includes the category of glues and adhesives, and believe it or not, your shower curtain, some personal care products, like it says here, other products that are pretty common, like your plastic bags, but you're not eating those, right? That's good. But again, this causes hormone issues. So it's kind of like disrupting your hormone system, can cause reproductive issues. And as you know right now, at least in the United States, there is a big issue related to fertility, which is a very, very big topic. And there are many potential causes, but toxins in the environment are one. And of course, metabolic disorders, specifically related to estrogens and testosterone. So pretty big problem. So we talked about some metals, and I told you I was going to talk a little bit about sushi and fish. And so that's where you get quite a bit of mercury. Now, mercury, back in the day, used to be in a thermometer. Now, nobody's eating the thermometers. Like you're going to break a thermometer and suck down the mercury or something. That would be bad for you, but don't do that. But we don't really have those kinds of thermometers too much anymore. But they are in fish and seafood, and primarily in kind of like the bigger fish, because the bigger fish eat the little fish and they last longer and things like that. But they also could be found in other products, that as well as some immunotherapies. And what those cause is some DNA mismatch, because they cause these reactive oxygen species, these species that you just cause all kinds of hell inside of your system, and ultimately might result in some cognitive or how you think impairment. So that's a big, important topic. So beware sushi. I'm not saying don't eat it, but just beware which fish you're getting. Now, when we look at the fish, these are some of the fish that are probably have the lower amounts of mercury. You know, you can see anchovies, they're very, very small. Sardines, very, very small. Shrimp, which might have extra iodine, which could be good for you. And then, of course, you've got some canned fish and salmon and things like that. Fresh salmon, especially if it's wild salmon, has a low amount of mercury. And so, you know, these are some of the products that have low amounts. So say for like oysters, you know, not a fish, obviously, but those are high in a few other products like zinc, which is actually pretty good for you too. Just don't eat too much of it. So these are the smaller type of fish. Now, if you get to the next category, you're looking at some bigger fish like mahi and tuna, certain kinds of tuna, halibut, just for the halibut. And, you know, you can take a look here. But the high mercury ones are the ones you want to avoid. So you've got grouper, which, you know, grouper is a tasty fish, but boy, you've got to be careful about that mercury content. And the biggie, the big biggie is tuna, even yellowfin tuna, which is one of my particular favorites when I go out and I have sushi. But you have to be careful how much. Of course, those pieces are pretty small, and you're not eating like 8 to 10 ounces at a time. Interestingly, Chilean sea bass. So sea bass is kind of like the one of the garbage fish of the sea also. And so they do accumulate a lot of mercury. So these are just some to be aware of. And some others here, other types of tuna, swordfish and shark, just don't eat them. I know some of you like it and may say, that's hogwash, don't do that. Well, sorry. But, sharks live a long time. They are the serious garbage disposal systems for the entire ocean. And so they eat everything. So be careful. Same thing with swordfish. Although they might be fun to catch, I'm not into that, but some people are. Same thing with like marlin. So be careful with that. How about some other metals? Well, lead. Lead used to be in things like paints. Definitely not anymore. We do not have that problem anymore, but it does cause neurologic problems and kidney problems and even some reproductive problems. Aluminum, I've already alluded to. Cadmium, I talked about. Actually, smoking can increase cadmium levels as well, and that does mimic estrogens, so it's an endocrine disruptor. And then arsenic, as I said, and that causes a lot of free radicals and all kinds of problems, and too much arsenic, of course, causes death. Now, back to pesticides. So we've got these chlorinated pesticides, DDT, DDE, DDD, and all of the Ds that you can think of, but they increase cancer, and they act as neurotoxins, and they can cause obesity, and this is a real problem. Of course, the issue is that, the food industry wants to have enough volume to feed everybody, and otherwise, things get eaten by animals, so you lose a substantial amount of your product just through the normal process of growing and other bugs and stuff eating them, in addition to rodents. So you've got to be careful, but these pesticides have been linked to things like cancers, including leukemias and non-Hodgkin's lymphoma. And so, you've got to start thinking about, well, does this potentially have a pesticide or not? And then is it worth it for me to eat this just in case I can't afford the more expensive types, which are the organic ones? And I'll show you that in a little bit. So benzenes, this is from coal and oil, and that causes leukemia. Formaldehyde, in addition to what I said about medical students being in the cadaver lab, they're in buildings, they're in automotive exhaust, cigarettes, and these definitely can cause cancers. And then other things like polycyclic aromatic hydrocarbons, these are when you burn organic compounds, and they are also cancer-causing. So this is a big problem. And vinyl chloride, just for the doctors out there that are getting ready to take a test, if it says liver cancer, vinyl chloride. That's the answer, okay? So how do you potentially protect yourself and your family? I think that's going to be the biggest concern that everyone has, because now that I've exposed these things, you're going to start thinking, well, what is the best thing that I could potentially do to protect everyone, including myself, but is it even possible? And the answer is yes, and the answer is no, unfortunately. The answer is yes if you eat a clean diet, you stay informed, you know what you're eating, you know where you're getting it from, where it's sourced from, you filter the water in your house, and you don't have to get the super, super fancy schmancy, all kinds of, I remove everything, but be careful when you get a filtration system, what it can do for you. Make sure you ventilate your house, especially if you're using gas in the home. So you want to just be very, very careful. In Florida, we don't really use heat too much, maybe twice a year, but everywhere else in the country, other than a few other states, it's pretty popular. So you've got kind of an environment that's closed up, so to speak. And then, choosing natural products, organic products, even your cleaning products. There are lots of brands. Like, for example, Myers is a little bit better brand, and you might want to consider something like that. And then, if you're into it, be an advocate for change. Let's try to change the environment. We've got all kinds of problems. I mean, I'm absolutely baffled by the fact that there's even an argument about things like climate change and whether it's a real thing or not. Doesn't really matter, because the reality is that it's happening. It's happening from a lot of people being on Earth. It's happening from a lot of things that we do. But, there's been a big push to really try to help improve what we can do. I mean, the advent of electric cars, of course, we're all wondering what the heck do we do with the batteries afterwards. That's not exactly environmentally sound. Nuclear energy, pretty messy. So probably in the future, we're going to see additional kinds of things. I mean, I'm not so sure solar will make its way anytime soon, because the efficiency coefficient is so low in the conversion of solar power to actual energy. but probably hydrogen in the future. There's already some buses in a few places, including, I believe, Tokyo, and even, I think, at the Olympics recently in Paris. So, just be an advocate for change and think about, what can I do to potentially help? All right. So these things, this is from Dr. Weil, but Dr. Greger from nutritionfacts.org has a lot of great information, particularly related to clean food, but a simple Google search or a search on any AI engine that you like will also find lots of that information. And so you've got dirty and clean, pretty much this, pretty black and white there. Dirty, clean. All right. So buy organic in the left category, things like apples and peaches and nectarines. Okay, those are yummy. Strawberries, they just grow in the ground, so they're obviously going to get a lot of pesticides so they can grow these biggest, juicy strawberries. But yeah, those might not be good for you. And tomatoes and cucumbers and things like that. And you can see some of the things that have lower in contaminants, like potatoes of different types and cauliflower and cantaloupe and avocados and so forth. So this topic, and I'll just kind of read this for those who might be just listening. So it's avocados, it's sweet corn, pineapple, cabbage, peas, they can be frozen, onions, asparagus, mangoes, papaya, kiwi, eggplant, grapefruit, cantaloupe, cauliflower, and sweet potatoes. So those are in the clean categories. And things change. So like tomorrow, especially since medical knowledge doubles every 60 days, tomorrow somebody could say, well, these are no good anymore. So just always take a look. Well, we want to protect our kids, but do we want to put them into a biohazard suit, protect them from everything in the world? And the answer is no, because there is something called the hygiene hypothesis. The hygiene hypothesis is actually what happens when you've got a child that is put into more of a sterile environment and a child that is put into an environment like a farm where you're exposed to everything. And it turns out that the kids that are exposed to the farm have lower incidence of allergies. They don't have peanut allergies generally, although it's possible. And they don't have a lot of the problems that occur when we sterilize our environment too much, because we don't get exposed to other antigens, which are the things that cause immune responses in the human body, and you're not exposed to it, so you develop all kinds of immune issues and potentially autoimmune issues, which might be genetic and then tipped over by the environment. Now, believe it or not, all of that really begins, this hygiene hypothesis really begins at the time of birth. So the other study that's interesting is a normal vaginal birth versus a C-section. And what happens is that the vaginal birth, you're exposed to some of the bacteria through the vaginal lining and vaginal wall, and when you're born by C-section, you are not. That's why they sometimes coat them in some of that material when possible, because those kids actually have some immune issues and allergies as well. And this is like us, adults, just avoiding everything, and I don't think that's the way to go. And so at the end of the day, we really have to be probably better stewards of our environment, understanding the environment, understanding where things come from and how they're grown, whether you're exposing yourself, whether you're putting things in your microwave that are not good for you, whether you're using pots that have a coating that you start seeing a little flaky and you're like, it's all right, I won't buy another pot. Buy another pot. Whether or not using underarm deodorant with an antiperspirant, which oftentimes has aluminum, and things like that. So just begin to think about it a little bit more. And the reality is that if we do this, working together, everybody can really live a healthier life. So I'm Dr. Corey Howard, talked a little bit about environmental toxins. If you have any questions, go to askdrcoreyhoward at gmail.com. You can check me out on my website. You can look on Instagram. You can go to TikTok. You can check us out on YouTube. Have a great one.